So at the outset, I would like to thank Dr. Rivari for giving me this opportunity to be with you. After a masterly talk by Dr. Sareen, it is very difficult to match him, but now my role is clearly chalked out. I will be discussing on nutrition, role of nutrition in fatty liver disease. So I'll, I'll discuss the effect of weight loss in NAFLD, role of diet in NAFLD, and physical activity in NAFLD. This, Dr. Sareen has already told you that in India and in US, the prevalence of fatty liver disease is more than 30%, and it is increasing day by day. As far as pathophysiology is concerned, as he has already told you, that there is a lot of free fatty acid which is mobilized from the adipose tissue and entered into the liver, and there this free fatty acid pool is converted into triglycerides, and once it has not been exported out of liver in the form of very low density lipoprotein, then it start accumulating there. And there is insulin resistance as well, so it is not utilized in the manner it should. This he has already discussed, and now I'll come on the guidelines of management of NAFLD. So as far as these guidelines are concerned, whether it is American or European, everywhere the main points which were considered were energy restriction, and everyone says that it should be 500 to 1000 calories less than what they were taking. So there is general agreement in all, whether it is a APASL, EASL, or ASLD guidelines, means American Association, European Association, and APASL, Asia Pacific. So there is a consensus on that. And then weight loss, generally 5% to 10% in various guidelines. So weight reduction is the cornerstone of management of NAFLD. And then for weight loss, obviously, nutrition and exercise. These are the two important factors which you can manipulate. Then there are certain macronutrients in the diet, so carbohydrate, protein, and fat. We can change the composition of diet accordingly, and this has been tried in various studies by increasing protein, percentage of protein in diet for that much of calories. In some, they have reduced the fat content. In some, they have reduced the carbohydrate content. I'll come to those studies little later. Then, as far as sugars are concerned, one thing is included in all guidelines, that we should avoid fructose. I'll come to that also in my talk subsequently. And then, important point is coffee is found to be protective, and physical activity is very important. 150 to 200 minutes of physical activity, exercise every week, that will lead to improvement in insulin sensitivity. So what are the effect of lifestyle modification? When we say lifestyle modification, means we decrease calories, increase exercise, and it has been shown that by nutritional intervention there was regression of non-alcoholic fatty liver disease. And same way, if larger percentage of weight loss occurred, then NAFLD remission also increases. So if it is more than 10%, then there may be regression in up to 90% of patients. If it is around 5 to 7%, then 50% regression. So more is the weight loss, more improvement in NAFLD. Same way, in this study also, they have clearly shown that with lifestyle modification and weight loss, there was clear-cut improvement in NAS reduction, and the score also came down. So what is the effect of weight loss? There is decreased transaminases, levels of OTPT will go down, decreased inflammation, decreased fibrosis, decreased cardiovascular risk, and increased insulin sensitivity. So this has been shown in this diagram very clearly, As the weight loss is more than 3%, steatosis improves in 35% of patient, and as it goes up to 10%, the fibrosis regression also takes place. So there are various concepts, various type of diet, low fat diet, low carbohydrate diet, and Mediterranean diet or keto diet, and there's a lot of confusion in the literature. Everybody has tried these various combinations, and as far as evidence is concerned, it is maximum with hypocaloric diet, low carb diet, Mediterranean diet, and to some extent keto diets also. Rest, intermittent fasting, and other modalities, data is emerging. To what extent it is helpful, we don't know. We can't say at this stage. So as far as dietary approaches are concerned, as I have already said, low-fat diet, when less than 30% of daily intake, energy intake, is with fat. Very low when it is less than 20%. Low carb, that means 10 to 40, less than 40% of daily energy in the form of carbohydrate, and very low carb when it is 5 to 10%. So this 5 to 10% carb diet we know as keto diet. A lot of fat we consume instead of carbohydrate diet. So which is the best diet? There is utter confusion in literature. It is very difficult to say which one is the best. We have to depend on what is prevalent in the society, what type of cultural milieu is there, and what people are consuming. We have to take that into account before giving any prescription. So what happens? Dietary carbohydrate, they lead to increasing circulating insulin, increased triglyceride concentration, and decreased hepatic insulin sensitivity. So this leads to de novo lipogenesis, means there is a lot of synthesis of triglycerides in the liver, which contribute 30% of the fat accumulated in the liver. So obviously this will lead to fatty liver. And when we take sugar in any form, both, if you see, the fibrosis and fat deposition in the liver keeps on increasing. And fructose that way is more harmful because fructose metabolism is not controlled by negative feedback mechanism as we see in glucose. And fructose consumes ATP faster, promotes synthesis of uric acid, and ensure metabolic disturbances. So fructose bypass the satiety signal also, and it upregulate a gene which lead to more fat synthesis in the liver. So what is the effect of low carb diet? These are the studies where they have shown that if we keep these patients on low carb diet, there is reduction in intrahepatic lipid based on magnetic resonance studies. And when we give low fat diet, there also we see reduction in fat. But 11 studies, means 7 RCTs, were selected on the efficacy and safety of low-carb diet in NAFLD, and 4 studies evaluated hepatic fat by magnetic resonance imaging, and 2 evaluated by CT scan. And in meta-analysis, there was no significant difference found between low-carb group and low-fat group on hepatic fat and transaminases. So both can be tried. Then coming to importance of macronutrient distribution without calorie restriction, again, variation in macronutrient distribution works even without calorie restriction, and this effect is not due to low carbohydrate but due to high protein. In these 2 studies, it had been shown. Increased protein intake with low glycemic index diet is associated with better weight loss and weight maintenance. High protein diet reduces adiposity gain from a high sucrose and high fat diet in mice. This was an animal study. Both high animal and vegetable protein diet given for 6 weeks could lead to weight reduction, decrease hepatic steatosis, and insulin level. And hypocaloric high protein diet given to NAFLD patient decreases LSM and CAP by 14%. Now coming to Mediterranean diet. You see, in 7 countries along the Mediterranean Sea, it has been observed in an epidemiological study that those who were consuming this type of diet In them, incidence of cardiac event were much less. So what contains means what are the ingredients of this diet? High in fruits and vegetables, food with minimal processing, minimal low sugar food, whole grains, legumes, nuts, oils and fish, relatively low carb, and uncooked olive oil, which is rich in MUFA and PUFA. So this constitutes Mediterranean diet, and it has been shown that in patients with NAFLD, when a crossover study was done with Mediterranean diet, there was decrease in intrahepatic lipid and increased insulin sensitivity in these patients. Overfeeding polyunsaturated and saturated fat can cause the same effect. If we are giving polyunsaturated fat, then there was a relative change in visceral adipose tissue and liver fat. Both will go up. So as far as dietary approach in NAFLD is concerned, there can be Western diet, Mediterranean diet, and there may be diet specific to decrease blood pressure, that is DASH diet, which is low in sodium. And as far as nutrients are concerned, we can decrease fats and to some extent carbohydrates, especially sugars. Fasting. This diet strategy implies an automatic energy intake reduction by restricting the feeding period, and the most common method are alternate day fasting and time restricted fasting. As the primary therapy in weight loss in NAFLD, it is expected that intermittent fasting will positively influence liver steatosis. These are two important studies. In fact, in patients, those who were during Ramadan, those who were fasting for more than 14 to 16 hours, it has been shown that there was a significant improvement in the metabolic markers such as waist-hip ratio, fasting glucose, and inflammatory marker in fasting group when compared with non-fasting group. And in the same, when they were followed up for a longer period of time in another study, there was a significant improvement in severity of hepatic steatosis and concentration of liver enzyme in the fasting group as compared to non-fasting group. But these are only few studies. Now, does exercise make a difference? Again, there are 3 meta-analyses, and where of 11 studies, 8 studies, and 18 studies, and there they have shown beneficial effect of extended in all patients of NAFLD. So exercise prescription, no definite regime is recommended. Aerobic exercise is a must to burn out fat, but those who have a poor cardiac reserve, in them you can't recommend these exercises, so there you can recommend resistance exercises. And choice of modalities based on compliance. What is the diet prescription? Calorie, 20 to 22 calorie per kg body weight, 50 to 60% in the form of carbohydrate, 15 to 20% fat, 25 to 30% protein, and more of complex carbohydrate instead of giving sugar. Avoid refined cereals, lots of salads, added wheat bran, limited simple sugar, and limit the visible and invisible fat, good amount of protein, and follow the traditional food pyramid. So these are good food for NAFLD. You can make out a lot of vegetables, food, dry foods, and then dairy products also. This is bad. Bakery product, sugar, and burger, fast food, and this is ugly. I think if you can give up, you'll be better off. Eat well and stay healthy. Thank you.